Welcome back. You're likely seeing more and more people masking up in places like the grocery store, malls, even your office. And while we've all dealt with masks for a while now, we thought we'd give a refresher on just how important they can be when it comes to mitigating the spread of illness.
After what we would say 15, 20 minutes, you're really uh, at risk. But some of these exposures happen if we were face to face right now and you were ill and I was ill, we could give it to each other in the span of seconds if that was the case. And so what masking does is it mitigates it. Unidirectional. So what we mean by one person masking certainly mitigates some of the risk, but bidirectional, so both parties wearing masks will increase that or decrease the risk and increase the protection even exponentially at that point.
Hartford HealthCare is strongly recommending it for everyone, especially if you're in a place where it's close quarters with a lot of people. They saw an uptick in RSV around Christmas and Hanukkah this year. Dr. Ulysses Wu, you heard there, says it's starting to come down a bit, but it's far from the only threat out there right now.
The biggest bumps have happened in influenza as well as COVID, and people are unfortunately coming in pretty sick as well. And there's also a lot of other respiratory viruses that are circulating: rhinovirus, adenovirus, human metapneumovirus, a lot of other viruses that I can mention that have also all been on the increase.
Now, Dr. Wu says there are many times when you really don't need a mask, like if you're outside or in a large, well-ventilated space. He says it comes down to common sense for many people, but for a certain group of people, he really recommends the masking.
Those with immunocompromised immune systems, for whatever reason, it may be due to medications, chemotherapy that they may be having, cancer, those at extreme of ages, especially elderly for the adult population, obviously. Those that may have comorbid conditions that will, for example, if you get COVID, it will increase your risk for a morbidity associated with COVID. So those that with diabetes, heart disease, excess weight, things like that.
Now, Dr. Wu says in addition to the masking, getting vaccinated, staying home when you're sick, and washing your hands regularly are still key staples to keeping that sickness away.